Hello doctors, and I've got 25 members so far. My name is Dr. Shahbaz Ansari. I belong from Karachi, Pakistan, and I recently cleared my PLAB-2. And this session will just be for PLAB-2, and I might as well involve all the question and answers that you doctors would ask me, and I would like to answer them as my experiences. So yeah, I did my PLAB-2 on the 5th of March and I got my results in 2-3 weeks. After that, I stayed in UK for my GMC registration. And as of now, I am GMC registered and waiting for jobs to be applied in the UK so I could start my NHS journey. Okay, so overall, is everyone able to hear me? So I get a better understanding that I need to adjust my mic or my camera or anything else. Just give me a thumbs up, give me a hi or something so I get an idea. It just, yeah, that's good. So yeah, I cleared my PLAB 1 OET in November 2019. Then I gave my PLAB 1 in March 2020. And I gave my PLAB 2 in March 2021. So far, the journey had a lot of ups and downs and some bumps, but I get to manage accordingly. So, any doctors have seats right now in the coming months, 2, 3, 4, 5 months. And this session will be best for the doctors who want an overall information and have their sessions, have their exams in the coming months, so they get a better idea. So what is PLAB? So this session will be more focused to PLAB 2 because if I tend to steer towards PLAB 1 and OET and the visa process, this session will be very small and I won't be able to do justice with the PLAB 2 introduction thingy. So what is PLAB 2? Does anyone have an idea what PLAB 2 is, or like for the people who might have attended my previous sessions? Because it's just that I am. Oh yes, Tayyiba, I'm planning to do sessions on OET and PLAB 1 consecutively, but right now, for the doctors of our subcontinent, India, Pakistan, Bangladesh, or all the other countries, they suffer more towards PLAB 2. So that's like my domain in which I would want to guide people. So let me just get into it, because as much as you people will interact with me, the better this session will be, and I'll be more involved. Okay, because by the end of the day, this session, I have cleared my exams already. So this session is for the people who are attending this session in order to help them. And if you have any questions, you might as well ask me and clear your queries. Okay, so what is PLAB 2? PLAB 2 is basically the alternate of CS from USMLE, and a lot of people might as well have given a lot of OSCE exams, OSPE exam, Vivas. So it's basically that. And PLAB 2 is basically an interactive session between a patient and you being a doctor, and the doctor and the patient are basically acting in a sense in order to maintain the scenario. Okay, as an FY2, which is a foundation year 2 training, which is to be applied for when you clear once you clear PLAB 2, you're able to manage the whole scenario accordingly, according to your level of knowledge and according to your level of clearance. Okay, so what is PLAB 2? As I told you, and they've got 18 stations, and out of 18 stations, 2 are resting stations, and the rest of the 16 are interactive sessions. Okay, so what you need to do? What you need to do is that the 16 station that you have basically are all the interactive session, and out of the 16 stations, 3 stations are examination or the simman. So one simman, 2 examination, and the rest of the 16 station are counseling stations, history taking station, addressing their concerns, and 3 stations were examination, and rest of the stations, 11 to 12 13 to 14 stations are basically interactive sessions, from which 5 to 6 stations are telephonic consultations and remaining are patient interaction. in which there'll be a patient and you'll be the doctor and there is no examiner. And because of the COVID scenario, the protocols of this social distancing and COVID protocol, there's no examiner to be seated. So all of the conversation that you do will be recorded in the mics and the cameras, and that will be assessed later on. So the simulator is not assessing you, he's just being a patient. They're paid actors. Okay, so this is it, and it has got medicine stations where you diagnose the cases. It has got counseling stations where the diagnosis has already been made, and you're basically giving them an appropriate management and addressing all their concerns and queries. Okay, so I've explained what is PLAB-2, what happens, what is the station distribution. Now let me just explain what is the passing criteria and the passing ratio. Okay, so yeah, it's a bit confusing, so let me just go through and show you the transcript. So I hope all the people can are able to see this. So this is basically my transcript. As you can see, this is my name, the PLAB-2, and the date was 5th of March, and I cleared. So what you have to do is you have to clear more than 10 station, and you have to get an above average score. Like for example, my score was 123 and I cleared 14 stations, and the minimum score to pass was 101, which was needed to pass. So you have to clear above the 40, above 10 station, and above the minimum scoring criteria. And as I mentioned, that you have got 16 stations, which are working stations. So in my scenario, I had 16 stations, but my sim man, which was the examination station, had a glitch. So overall, every other student was struggling in this station because they did not know what to do and what the appropriate management because of the glitch. So they just canceled my station. So my exam was out of 15 stations. So I cleared 14 out of 15 stations. And what is the mark distribution? So the marks are distributed from 12. Every station has got 12 marks, and it's distributed in between four marks each. So the initial 4 marks, like for example, my first patient was station was an angry patient, and the maximum score was 4 on data gathering. These are the 3 criteria on which this session, the exam is being marked. So you got 4 marks in data gathering, 4 marks in clinical skills, which is the management part, and the remaining 4 marks are in the interpersonal skills, as in how you manage the condition, how you talk to the patient, how much empathy you showed, everything. So for like if you can see my report card, the first patient I had was an angry patient. So in that patient, out of 4, I got a 4 in data gathering, and in the clinical management, I got 4. I got 2 out of 4, and in the interpersonal skills, I scored 3 out of 4. So the amalgam was 9, and the passing score of that station was 6.4, and I passed this station. And who now people would be thinking, well, who decides the passing score? So basically they've got 18 candidates, and they just rank accordingly that what station the minimum score was for majority of the doctors. So that is called percentile system, and this is the score which is set by you people sitting in an exam on that very day. So you have to clear it, have to get passing more than the passing score. Like for example, my score in the first station was 9 and the passing score was 6.4, and the score can be as low as 4.95 or 3, because if you see in the third station, the passing score was 4.95, in which I got 6. So yeah, you get it, it's a percentile system. So there can never be one particular score of a station which is said to be passed. Okay, so you can never predict. And after that, this, if you can see, is the skill area where the examiner basically gives you a tick in order to tell you that this station that you did, you need to improve this or you need to improve that. Like for example, if you see the first station, which was an angry patient, so we are being scored on consultation, diagnosis, examination findings, and all of these criteria. And if there is a tick, it means that this part needs to be a bit better. This is basically a feedback from the examiners itself who are marking accordingly. Okay. So the first patient I had was an angry patient. So I just had a tick in the management part, and rest of it I had no issues. And the third, the collapse patient, I had some issues with my consultation, and yeah. So this is basically the feedback which is given you by the examiner himself, on which you're being scored. Okay. So yeah, screen is lagging. Is it fine now, Rishabh? So yeah, doctors, do you have any questions so far? Is everything clear? Yeah, just give me a heads up, give me a thumbs up if you have any questions, if I'm going too fast, if I'm going too slow. Yeah. So yeah, uh, that's good. So yeah, this is, so I've explained you what is PLAB-2, what is the passing criteria, on which slow, please go fast. Okay, you want me to go fast? Okay. So what is PLAB-2? I've told you. What are the passing criteria and passing ratios, and how does the transcript looks, and what should you, what on which criterias are you people are being marked on. So how will be the scenario? So you will be entering into a station, and this is your gate. Okay. So there will the cases. Every station has a bell, and you'll be giving 1 minute in order to read the scenario, which will be up outside the gate, and you'll be given 1 minute in order to read that scenario and to make a mental plan of what you're going to do inside. Okay, then there will be another bell, which is going to be an 8 minutes bell, where you have to enter the room, speak out your name and GMC number out loud. Then you'll be seated, and basically your consultation will start once your second bell ends, and there'll be another bell by the end of the 8 minutes, where you have to move to the other room and do everything continuously for 180 minutes, more or less. Okay, so this is how it is, and there is no gap, and you'll get only two resting stations. The first station might as well be your resting station, and the last station might as well be your resting station, so nobody can be sure. Okay, so it is how it is. So couple of scenarios will be of medicine, couple of scenarios will be of counseling. So everything clear so far? If I'm making any sense, if anybody has any questions, because the more you people will interact, the more I will enjoy, and I'm here to answer all of the questions, because I've done this session a couple of times. So yeah, I do believe that it does get a bit boring after a while, because I'm just teaching and saying the same things again and again. Oh, I think today the doctors are very tired, so I might as well be the one who does all the talking. So yeah, this is all the introduction that I had. And now, going, how long will the actual exam should we take? Well, that's a really good question. It's just that it depends upon how good are you in your clinical skills, because being able to work in the subcontinent, we've got very different ethical scenarios, we've got very different ethical values, and the patient are also very different. So depending upon that, it might as well be 1 month, it might as well be 2 months or 3 months. So depending upon your clinical skills and your interpersonal skills and how well you communicate. And most of the doctors working in subcontinent are working in their regional language, or Urdu, Hindi, or Bengali, or any other language. So you also have to be fluent in English and be able to empathize in that very language. So yeah, I've got people who just managed to clear the exam with 15 days, and I've got people who had to practice for a couple of months in order to get the grip. So yeah, this is a question to be answered by you yourself. Can you please elaborate the sources of PLAB-1 and PLAB-2? Well, PLAB-1, I did only two things. I did my USMLE first aid as a reference book, and I had been studying that book for quite a while now, so I had a good grip on it. So I just studied that, and then I just referred to a question bank which is called Plabable, and I just did that, and that's about it. I did not attend any online classes. And as far as the PLAB-2 is concerned, yes, I did attend classes from Aspire Academy itself for 10 days. But by the end of the day, it does not matter which academy you take and which courses you take, because what actually matters is your practice and how you approach the patient. And basically you have to strike an impression in that 8 minutes, so the examiner will be compelled to give you marks. And believe me, everyone is there to make you pass through the exam, and inviting you in the NHS, because they are short on doctors, and the polite you are, the humble you are, the better the chances of you getting through the exam. I think we can ask questions at the end of the session. We'll finish the session. No problem. It's just an interactive session. I'm just giving you 5 minutes of things, so I can. It's just a 5 minutes break, so I'll be able to answer all the questions, because PLAB-2 is basically, if you people tend to discuss it over and over again, the discussions won't end. And once you get practicing, once you start practicing, once you actually get into the scenario, you'll get everything in a better way. Okay. So yeah, just drop in all the questions and I'll be able to answer them lately. But if just to give you a better understanding of what you should expect, if anybody could be kind enough to become volunteer, so I'll give them a scenario and accordingly we can act, and I'll be able to tell you, and it'll be more of an interactive session. Then everybody's going to be enjoying. Can you hear me, Tayyaba? I'm really sorry. The internet might be a bit crooked. Okay, so Dr. Anime H, you would want to practice? Oh yes, just turn off your mic or turn on your video so everybody could see and get a better understanding.
Hi. Sorry,
Yeah.
I can't play the video, but is it
Oh,
okay if I
no
do
problem,
the
no
audio?
problem, no problem, no problem. So, do
Thank
you
you.
have a date or something? You've cleared your PLAB-1. What stage are you, doctor?
So, okay, so I have cleared my PLAB-1 and I want to remain anonymous on dates and everything, if it's all right.
Oh yeah, absolutely. And when is the exam,
Okay.
if you don't mind me asking? Do you have a date?
I'm afraid I can't answer that as well. As I said before, that because of the date thing, I really don't want to discuss it. Yeah, sorry.
Oh, no problem, no problem.
But
So,
it's like, okay.
so far, do you have an understanding of PLAB-2? Have you attended any academy, any practices you've done?
Yes, recently I have joined one. The academy is Mo Academy, and I have subscribed to the online course. It is good, and actually, I have attended 5 to 6 sessions so far. I am understanding, but just want to practice with you to see where I'm standing right now.
Oh, absolutely. So just to get a better idea, so you get a better understanding, do you happen to have any session that you would like to do with me? Because the best way to learn is by practicing, and I'll be able to give you some advice if you like, because I've cleared the exam, and
Okay.
yeah, so that's the thing.
Yes. Okay. So I have done tiredness, rheumatology, and dermatology.
Mhm.
So from these, if you want to pick any scenario, so you can
Well,
just ask me.
rheumatology, tiredness you've done. But the thing is that tiredness is a very difficult topic. And are you sure you have done tiredness? Because
To be honest, as I said, I've just started, but I can do the practice and then we can see where we can go on. I'm giving you the option like tiredness and rheumatology. For me, everything is difficult right now, but it's up to you if you want to
Well,
choose any.
let's give you a generic thingy, because
Yeah.
you'll have a better understanding. Because I just don't want to drop all the bombs of tiredness, because tiredness is a very
Yes,
big
please.
kind of thing to be into at this point of time.
Yeah.
So let me
Okay.
just give you a random scenario. Like a 35-year-old male patient, his name is Shahbaz, comes to you in the GP clinic in order for some complaints regarding cough. Please address his concern,
Mm-hmm.
relevant history, and give an appropriate management plan. So this is the kind of a thing which you will get outside the room. At times you might
Hmm.
not get the complaint which I just told you, which is cough, and you just get this complaint station like a 30-year-old male named this comes with some has come with some queries. Please address his concerns and take relevant history and give an approved management plan. Okay. And
Okay.
at times you might as
So
well
Shahbaz,
get.
would you mind,
Mhm.
sorry,
No
would you
problem.
mind repeating the question, the one that you're going to give it to me?
Yes, so I'm just giving you an overall view that you can get very short scenarios, maybe 2, 3 lines, and you can get like a big scenario with one whole big page. Okay, so just be prepared
Okay.
and practice everything, because the big the scenario is, the easier it is, because they've given you all of the information. And if they've given you just 2, 3 lines that this patient has come in, please address his concern. So you have to go in with an open-ended approach, and you do not know what
Okay.
you are expecting. So just to make it a bit easier, I've told you the complaint, which is cough. So I am a 35
Okay.
years old male, and I've have cough. Please address his concern, take relevant history, and do an appropriate management plan.
Okay.
Okay. Yeah.
So yeah, can we start? Do we have a timing?
Yes, that's the thing. And just to give you a better view, that this is the GMC bell which you'll be hearing. So it's better to practice with this, because then you are able to, your mind starts working when you hear this bell. So you have to go into the kill
Hmm.
mode. Okay. So can you hear me? Just tell me this.
Okay.
Can you hear this?
Yeah,
Okay. So
that's fine.
let me just
Thank
start.
you.
Yeah, start.
Okay. Okay. Hi, Shahbaz.
Hello.
Oh, hi. May I have your full name and date of birth, please?
Well, my name is Shahbaz Ansari, and my date of birth is 9th November 1993.
Thank you. And how may I call you?
You're welcome, doctor. Yeah, Shahbaz is fine.
Okay, okay. So Shahbaz, my name is Dr. Ikra, and I'm one of the junior doctor. So how may I help you today?
Well, doctor, it's just that I've been having this cough for quite a while now, and initially I thought it's gonna go away on its own, but now this cough is bothering me so much that I'm actually embarrassed to sit uh, and do my work, because it's being the other people are also being disturbed, and I'm embarrassed. So it was about time that I come see you.
Okay, and can you tell me a bit more about your cough?
Well, I'm having this cough. Initially, it was a dry cough, but later on,
Okay,
slowly, it turned out to become like a productive cough with sputum, and it's been there
okay,
for a couple of months. I cannot pinpoint how many months exactly, but yeah, this is
mm-hmm.
about it. And
Okay,
couple of days back, I did observe some tinge of blood, but I'm not sure if it's
okay,
related or not.
okay. Thank you.
No
So
problem.
Shahbaz, is it okay if I ask few questions just to get the idea what what kind of condition you have?
Sure, doctor, whatever you want to know.
Okay, so tell me more that as you've already told me that you had like cough since 3 months and initially it was dry and then productive and it contained blood. So have you noticed anything else apart from these symptoms? Let's say, have you noticed any fever?
Well, I've not checked exactly, but I do feel a bit warm all the time.
Okay. And what about weight loss?
Uh, I'm not sure if I have had any weight loss, but my friends do say
But
that.
sorry.
My friends do
Yes.
say that my clothes are getting looser. Yeah.
Okay. And how about your appetite?
What about it?
Recently, in the past cough,
I'm sorry.
has it changed your appetite? Like, has it
Yes,
changed
I don't feel
since
like
past couple of months?
I don't feel like eating.
Okay. And what about sweating? Does your body feel sweaty at any time?
Well, I do feel a bit, damp in the night, but not in the day.
Okay.
Yeah.
Okay. I'm very sorry to hear that.
No, it's
And do you have any, sorry, do you have any bleeding from your mouth apart, like in the stool or from your mouth?
no, doctor.
Okay. And okay. So, Shahbaz, is it all right if I ask a few more questions? Yeah. Tell me more about your diet.
I think you've asked that question, but yeah, I did just don't feel like eating, so I just eat whatever I get whenever I want.
Okay.
Not,
Okay. And what about exercise?
no, doctor. I just feel too lazy and lethargic. Yeah.
Okay. And do you smoke?
Yes, I do smoke. I smoke like half a packet of cigarette a day.
And since how many years you have been smoking?
Well, it's maybe 9 years, 10 years. I'm not sure.
Okay. And what about alcohol?
Not much of a drinker, doctor. No,
Okay. Are you on any medication?
no, doctor.
Okay. Does anybody is affected the way you are?
No, doctor.
Okay. Any medical conditions like diabetes,
No, doctor.
any high blood cholesterol,
No, doctor.
and tuberculosis?
You're asking me or you're telling me?
I'm asking you.
No, doctor. No.
You have- Thank you very much. So, have you been ever admitted in the hospital before?
No, doctor.
Okay. So, Shaba, what concern or at this stage?
I'm sorry.
Do you have any concerns about your condition?
Oh well, yes, doctor. It's just that I'm scared that could it be cancer? Because these are the very complaints I hear people have during
Okay.
as I've got it months and I've faced weight loss.
Okay.
Could it be cancer?
We'll get back to that. Shahbaz, is it all right if I examine you? I'll be
Yes.
observing your blood and pulse rate and
Doctor, your voice is very distorted.
hello.
Yeah.
Is it okay if I examine you? I'll be checking your blood pressure, temperature, pulse, and respiratory rate.
Yeah, the pulse is high, the blood pressure is normal, and the patient is febrile. Low
And
grade fever.
okay, thank you so much. And I will examine your chest as well. Okay,
Okay.
so thank you so much. So, Mr. Ansari, from the history that you have given me and the findings that you have that I have found, I suspect that you might be having tuberculosis. Okay, So this is because you're having productive cough and there is blood in it. But we have to confirm this further. But I will be referring you to the senior, and he will be doing furthermore tests. In the meantime, I will be sending out your blood test, and I'll be checking your blood sugar levels, urea electrolytes. Is it okay?
Any particular test you would like to do on me, doctor?
Yes, I would like to run few more tests. Like I will do blood test, and I will do the blood sugar level. I will be checking your blood sugar level, urea electrolytes, and ESR. And I will also do the chest X-ray to see if there is any infection in your chest.
So on
In
the
the
chest
meantime, I will refer you to the
X-ray,
senior, to
on
the
the chest.
chest consult.
Yeah. So yeah, station ended. So how was it?
Are we done?
Yeah.
Oh, I don't know. I have no idea. I mean, there was like in between disruptions, so it might have taken like 1 minute or so. But
But
yeah,
that's the thing.
you
When
tell me.
it's just that if I say 8 minutes, you'll never get 8 minutes overall, because you'll be entering into the room, you'll be sitting down, you're scanning the rooms. Yeah, 30 seconds will be wasted. So you never get 8 minutes
Yeah.
fully. Okay, and the kind of glitches that you have
Okay.
right now, there might be glitches there as well. So you'll have to be
Mm.
prepared mentally that I do not have 8 minutes. So just practice accordingly for 7.5 minutes. So let me just give you
Okay.
an overall thing. If you do want an overall feedback here, or you can just I can just privately message you if you want. It depends upon you. But
No, no, that's all right. Give. You can give. I'm ready because I'm just a newbie, so that's why there are any mistakes.
okay, so let's just start from the introduction. Your introduction is really nice, but try to make it a bit one-on-one conversation. Okay, then let the patient answer. Let the patient reciprocate. Let the patient just respond to your salutation or your hello or anything that you tell me. Just let him respond accordingly. And the thing is that I think you've started right now, so there was a bit of a lack of structure. And if you have a structure and a roadmap and you stick to it, you will be able to manage everything appropriately. And once you have a structure, you won't be able, the patient cannot steer you according to their direction. So that's the thing. There was a lack of structure, and if the patient is not feeling the emotion, saying I'm sorry does not make any difference. Okay, so just reciprocate the feeling of the patient accordingly. If you think he might be sad, you might as well respond. But if you think he's not sad, you might as well let it go. So yeah, that's the thing. And a lot of times you ask me a couple of questions, but they were a bit vague. You're asking me question like, is there any bleeding from your mouth or your back passage or anything? That was very vague questions. You were basically giving me a lot of things in one question, so the patient will get confused. He's not a doctor, he's just a layman. So the clearer your instructions are, the
Okay.
better answers you can get out of him. And just
Okay.
skip on the
I
questions.
was trying to relate. Okay. So as I said before, I have done tiredness. So I was thinking this might be related to that, and I was excluding anemia and all the other
Well, the
causes.
thing is
But
that
then cough
in a
was
young
from the
patient,
respiratory system.
in the young patient, it's very likely to be a cancer or any tiredness cause because it's a young patient. So in this patient, what your disease
Yes.
could be, it could be pneumonia, it could be an upper respiratory tract infection, it could be TB,
Yes.
it could be PCP. Yeah, that's
Mm-hmm.
about it in a young
Yeah.
patient. It might as well be cancer, but the likeliness of cancer is very less. So that's the thing, and that is the very reason that
Okay.
1 minute matters a lot when you think of the DDs. And once you go in, you just exclude all your DDs and make one diagnosis, and that diagnosis is also a suspected diagnosis. There were a lot of repetition of
Okay.
so yeah, I'll give you a review, a detailed review, if you could give me a text, because 1 minute is left. So let me just summarize everything. And
Okay. Sure.
yeah, I'm really sorry. Zoom does not allow me to talk a lot. So that's the thing. I hope I would was able
Okay.
to answer questions and everything. And if there is any questions, do let me know, and I'll be able to give you another session accordingly in Plabbable. What did you purchase? Well, it's just the Q bank. It's just the question bank, and that's all. No big mocks I did. Oh, yes, it was. It could have been better if people would be a bit more interactive. But there is one question: should we revise the whole Plab one stuff? It depends upon you. It depends upon you. I did not. I just did Plabbable once, and that's